Hello, everybody, and welcome back. This is The Edge of Adventure. Of course, my name is Adam Asher. Great to have you with us today as we travel to Guatemala. And my guest today is joining us actually from Antigua, Anne Kraemer from Wuqu'Kawoq, the Maya Health Alliance. Welcome to the program.
Thank you so much. It's wonderful to be here.
Well, it's great to have you. Thanks for your work. Thanks for taking the time to join me and to share this time with the audience as well. Did I pronounce that anywhere near correctly? Wuqu'Kawoq.
You did. Actually, it's perfect.
And that is in what original language?
That is in Maya Kakchikel.
And the Maya Health Alliance, where you have worked for approximately 15 years, you guys have been working so hard there. What is your focus? All right. I mean, obviously, it has to do with healthcare, but it's this a very unique organization with some very unique objectives. Walk us through the overview.
Definitely. Thank you, Adam. We've been working for 15 years, really focused on bridging a major gap in care here in Guatemala. Basically, in Guatemala, over 50% of the population is indigenous Maya, and there's over 20 different languages spoken in Guatemala, plus Spanish. And unfortunately, oftentimes the Ministry of Health really only focuses on providing their care in Spanish, but that's leaving out a major portion of the population here. So we really focused on providing healthcare for those who need it most. And those are most often indigenous rural people here in Guatemala. So we currently provide care in 6 different languages across 8 departments, or kind of the central highland region of Guatemala.
My guest today is Anne Kraemer, Executive Director, but also, let's note, she's also one of the co-founders. And what brought you, let's get a little bit of the background. How did you discover personally this need?
I came here over 20 years ago when I was focusing on my master's degree in anthropology. And I was very interested in looking at the intersection of indigenous communities and the whole idea of progress and basically what it means to, get ahead in life and how people do get ahead and why. There are so many nonprofits in Guatemala. There's over 20,000 nonprofits, yet oftentimes there's a real failure to kind of make a change in Guatemala. The overall health indicators and education indicators haven't gotten better in the last 10 years. And I was very interested in Guatemala because it's a very unique country. It's one of the few countries in the Americas where the majority population is indigenous. And looking at kind of the history of Guatemala, you can go back 2,000 to 3,000 years and look at the indigenous Maya population. I think we're familiar with that when we think about National Geographic and we think of the temples and the covers of National Geographic and really great cities like Tikal. But a lot of their ancestors and descendants, well, the descendants are still alive today, and they speak many of the languages from the original Mayan language. Yet oftentimes these people are the most, forgotten people here in Guatemala, and they're often left out of the Guatemalan structure, education system, and healthcare system. And when I was here doing my research, I really could see how people were left out, and that oftentimes the failure to understand their culture and their language and to really work alongside people really left people out. And it meant that communities were not getting ahead, or communities got frustrated with other nonprofits that were kind of bringing them maybe technological solutions that didn't fit into their worldview. And in doing that research, I really saw this basic need. And people in the community where I was learning Kakchikel Maya came to several of us who were learning the language and said, we really need healthcare. A lot of our people, they just don't speak the language of their doctor or of their nurse. And we really need this help. And that was where we jumped into action, and we really saw that we could fill this need.
So there's a couple of things then that I want to be sure I understand. The populations that you're describing, the wonderful populations with their indigenous languages and so on and so forth, is it often the case that they do not speak Spanish?
It's a great question. So oftentimes people speak some Spanish. It kind of depends where you are in Guatemala. I would say in some areas, people speak kind of what is a trade Spanish, especially women and children. They can go to a market and they can buy things in the market in Spanish. But when you're sitting down to talk about your healthcare and how you feel and what's going on in your life, they can't do that in Spanish. Just often, as many people, learning your second language is quite hard. So really, when you're trying to think of empowerment and caring for your body or your children, you want to do that in your first language. And so that's really where this great limitation comes in.
So then, and again, of course, my guest today is the executive director and co-founder at Maya Health Alliance, Wuqu'Kawoq, and her name is Ann Kraemer. So it's wonderful to have her on the show today. And part of what we always have to do, right, to understand what an organization does, what you and your friends and your colleagues do, to understand what you do, we also have to dig into the culture and what the communities are like. And I'm noticing you have a love for these communities. You have there's this affection that you have for the language and for the people of these communities. So, what is life like for these different groups?
Life is hard. I think a lot of people right now are probably aware of immigration that's been happening into the United States, especially from Guatemala, Honduras, El Salvador. And people might be wondering why. Why are people coming and taking that really long walk that takes weeks to months to cross into Texas, into the United States? It is a major risk, and they're willing to take that risk because life here is very hard. Unfortunately, there's not a lot of job opportunities for rural Guatemalans. Oftentimes, you can only get through third grade or sixth grade in school before you have to return to the fields and help your parents and work. And due to climate change and different changes within Guatemala, due to market prices, farmers aren't able to make what they were in the past. And oftentimes, when you look at a young person who's maybe 14 or 15, they're looking at their parents and how hard life is. They sometimes don't have electricity. Sometimes there's just not enough food to eat. And when I mean not enough food to eat, that's a tortilla with some salt. That might be 2 meals a day. And that's really rough. But yet, in some of these communities, they also do have access to Facebook. They have access to, what's happening in the world. They have access to friends or family members who have gone to the United States. And so they see that there are other possibilities. So people are crossing into the United States. So life is hard. Some women have to, walk several kilometers to bring water back to the house. Most women have to spend the majority of their day cleaning their house. Everything's done by hand. They have to cook over a fire. So if you imagine starting lunch at 11 a.m. to eat at 1 p.m. because you have to start your fire, you have to, do everything by hand. There's not really canned food that they're buying. So it's definitely a slower paced life in some ways, but it's very hard.
And let's talk a little bit about how the Maya Health Alliance, Wuqu'Kawoq, is unique. And this would be my question. Again, I always put myself, I'm learning right along with the audience, right along with the listeners and the viewers of the program. So sometimes I have to ask very basic questions to make sure I understand. Do you and your team, are you providing the healthcare to these to these communities? Are you training those who do? What is the connection specifically on the ground for the Maya Health Alliance?
Yes, we are providing direct care services to over 20,000 people every year. So our goal is we hire and have local nurses and doctors providing our healthcare services directly in the language, and they dress and look like the folks that they're serving. And so we do a lot of capacity building, and our team, we have over 70 team members who are working in the field every day. And often we go house to house to provide women's health care services, nutrition, child health, diabetes care, because oftentimes the houses are very far apart. People don't have money to get to health centers, or because of a 30-year-long civil war here in Guatemala that ended in 1996, a lot of people don't have trust in the government. There's a lot of discrimination and racism. There's a lot of work to do here. So we do provide direct care services, and we also collaborate really closely with other nonprofits and the Ministry of Health, because our goal is not to duplicate services. Our goal is really, to provide state-of-the-art healthcare for those who need it most in these rural communities. And so we go into a woman's home, for example, and we'll talk with her about her women's health needs and her child's health needs around nutrition and what they might need to eat and how they can improve their diet. And if they don't have enough food, we can enroll them into a program where we can provide them food, and we provide education around diet and different ideas for recipes. All moms need helps on different ideas for recipes. So we really are there working alongside people, building that trust relationship. And I think that's why we've had so much success, is that our nutrition technicians, our nurses, they're there alongside people. They're from these communities that we're serving, and they care as much about the work as I do, and they want to see a difference in their own community.
All right. So there's this element too, then, of leadership that's coming from the community itself.
Yes, definitely.
Okay. We are talking today with Ann Kraemer. She's the executive director, also one of the co-founders at Maya Health Alliance, and in the original language, Wuqu'Kawoq. Now, is that a direct translation, Wuqu'Kawoq?
No, that's a really great question. So Wuqu'Kawoq is a day in the Mayan calendar, what's the sacred Mayan calendar. And Wuku is the number 7, and Kawoq is the day for midwives and doctors or healthcare service providers. And so that calendar on November 7th in 2007, or sorry, January 1st, 2007 is the day that we were founded. And that day in the Mayan calendar was Wuqu'Kawoq. And so we chose the traditional way for Mayans to do naming, and that is to adopt the day in the calendar.
Always learning something amazing here on the Edge of Adventure. And Ann Kraemer. So you speak this language. How many different languages are you comfortable speaking?
Very comfortable in Spanish and fairly comfortable in Kaqchikel Maya.
The key to what you guys do, and I talk to so many different types of organizations, and as we think about humanitarian work and these types of organizations that focus on social impact, making a difference, two key concepts always come up, and I want to get your perspective on them. Let's start with the first one: sustainability. Like these things. It's not great if we pour all our heart and soul into something and then it can't survive long term. Sustainability, how do you guys approach that?
That's a great question, because sustainability is a tough word, especially in healthcare. Nowhere in the world is healthcare sustainable. Unfortunately, we have a lot of work to do worldwide on that. So we really try to look at it in a different way. Many of our patients cannot afford to pay for services. They can barely afford to eat, so they can't afford medical services. So all of our services are free. But we look at sustainability in a different way. We really focus on building capacity in Guatemalans. So we don't bring, lots of people from the United States or from Europe to do medical services. While we do bring some people, they focus on training Guatemalans in how to do incredible healthcare, as well as research. We do research that's called intervention science, that's really focused on, finding out what works in this context. And so right now we have over 70 staff members that are nurses and doctors that are all local Guatemalans who they're learning and teaching us. We're always working together to do the best for the community. And we see that as sustainability, as building the resource here in Guatemala. So if we're not here tomorrow, there's 70 doctors and nurses who can, work for other organizations, who work for the Ministry of Health, who can be leaders in their own community, because we work heavily also on training leaders within our work, especially women leaders. Here in Guatemala, unfortunately, women oftentimes are very ostracized. Men usually, lead the show. And so helping women to find their voice and to be empowered is really important for their families and their communities.
Another term that comes up when we're talking about business, whether in the NGO concept, your business model, you make things work, is this idea of scaling, right? You take something, you make it work, and then how can I get this so that it works in more places and it grows? Your thoughts on the term and the objective of scaling?
Great question. I think for us, we scale through our partnerships. I think scaling is important in many ways, but it's not the end all be all. I don't think an intervention that can work in central Guatemala means that it can work in Honduras or that can work in Mexico or in Central Africa. I think we really have to understand what needs to be tweaked, adapted, and adjusted in order for it to be as successful as possible, what funding it needs to work. So here in Guatemala, while we do serve a large clientele, our goal is not to be in every community and have a health center in every community at all. We're really working alongside the government in order to help them because they already have many buildings. They already have a large staff workforce across the country. And so we really want to work with them on training. And we've been working heavily in the area of nutrition and taking what we've had a very successful intervention over the last decade that has really reduced malnutrition by 30 to 40% in some of these communities. And we're working with the Ministry of Health and the nutrition arm of the government in order to work together and take some of our learnings so that they can adapt and scale that with us. We find that is a really important way that we can be sustainable and do scale.
Today, we have on the program the executive director and co-founder, Ann Kraemer, at Maya Health Alliance. And I'm just going to keep saying Wuqu'Kawoq because I think it's so awesome. I just a little jealous, so might need to take some classes. Where does one go, by the way, to learn this Mayan language?
Great. You can come here, definitely. We also have an online class that we do through the University of Maryland. It was presential, but with COVID-19, we've gone to online. I also originally started learning Kaqchikel Maya at the University of Kansas, and they also teach it at Tulane University. So there are universities in the United States that teach it. And of course, there are places here that you can learn it as well.
It's important, isn't it? When you think about the culture and the traditions and the families and the communities, it's important that they preserve that natural original language, and it's important that it be honored and considered. And I know you mentioned earlier in the program how many different languages. What was the total again for the number of indigenous languages used?
22.
22 indigenous languages. Okay.
Mm-hmm.
Fascinating. This is the Edge of Adventure. I want to talk a little bit too, Ann, about the investment that you make, that Maya Health Alliance makes in the healthcare workers.
Mm-hmm.
What are the ways that they really need support, and how are you guys providing that?
One of our key pieces is to hire a lot of women, often because the clientele we have are women or children. And so it really works much better if our staff, a lot of them are women, especially in those two programs. So I think it's really important to invest in women, providing them with, a working wage, a living wage that they can then bring home is really important. But also the key pieces of empowerment and leadership, so that they can have a voice at the table and they feel safe and can share their opinions is really important. But also we do a lot of training for our entire team around, how to provide healthcare, the bedside manner, also excellent world-renowned care. We take all of our information and share and training that we have, all of the approved protocols from the WHO, all of what comes with the Guatemalan Health District, to make sure that our staff has the up-to-date information that is the best for serving our communities. We also focus heavily on databases, computer training, making sure our staff have all of the tools that they need to work in the field. All of our teams are working online, doing direct data entry in real time every single day into our database that, our team can access from all over the country or all over the world for what's ever needed. And we do a lot of quality improvement. So our team's always sitting down every month to review our indicators together and make sure that they learn what is best for my community. What do I need to do? How are we reaching our goals or not? And so that as nurses and doctors, they feel empowered to know what is the best next step for their community. So I think our team is really excited about learning. They're really excited to learning about science, about research. And so it's a really great teamwork, and we're doing a lot together.
Talk to me about that research. And I'm smiling here, kind of thinking about my own team and some people on my team who are great at research. And it's an amazing skill set. And some people like me I don't think I have it. I'm not a researcher, but talk to what is the data that you're researching, and how can you leverage that into the type of improvements that you're striving for?
Yeah, thank you. So we focus heavily on what's called implementation science. And basically, we're doing research to find out what healthcare interventions work best in Guatemala. So, for example, we have done a lot of research on nutrition. Here in Guatemala, sadly, over 46.5% of the population has chronic malnutrition, which means they don't have the right kind of foods between 0 and 2. And so they're often very short for their age. But what that means is that their brain is not getting all of the nutrients necessary to grow properly. And this affects their entire life, meaning they'll learn slower, they're going to walk slower. Oftentimes, they might drop out of school earlier, and it leads to a lot of health implications later in life, like diabetes and hypertension. So we focus heavily on malnutrition because often in the rural communities, 80 to 90% of the children can be chronically malnourished, and this affects their entire life. So we've done implementation science research where we've done a clinical trial to really understand, comparing what the Ministry of Health's intervention is of providing some micronutrients and providing what our intervention was of really micronutrients plus, eggs and beans, and really looking at this one-on-one individualized education for the mother over 6 months. And we can see that even, providing food to children obviously helps them grow. But the most important point is really this education for the mom so that she knows what she can give the child. She knows, how thick the food should be, what age groups need to eat how much every single day. And another intervention piece that we're doing right now is really focused on early childhood education and helping support moms to know, what can they do to help their child, start to speak, singing with them, having them do early movements. And all of this is based on research that we're doing in the communities, in Kakchikel, Quiche, Zutuhil, Maya, doing it in these languages, in their homes. They're a part of the research, and they're giving their feedback, and they're learning along with us. But once we do that research and we know, what health intervention works the best, for example, in malnutrition, then we implement that into our program. And within our program, we're serving over 1,500 children a year. And we can see this major transformation in reducing their chronic malnutrition. And this is now what we're working on with the Ministry of Health to help implement that countrywide. It's a slow process, but it's something that we can see be effective. And because we have the research and we have publications about its effectiveness, the government's really interested in talking with us.
And we are talking today with Ann Kraemer. She's the executive director and a co-founder at Maya Health Alliance, Wuqu'Kawoq, and you can look them up online at mayahealth.org. That's mayahealth.org. And of course, Maya is spelled M-A-Y-A, mayahealth.org for more information. Or, hey, listen, you can also look them up at wuqu'Kawoq.org. It's going to take you to the same place, same website. But it might be easier just to type in mayahealth.org and learn all about them, all about this wonderful work, their heart and their commitment. And let's talk about that for a second. Commitment here to making a difference. Think about a reality. There's what reality is unacceptable? Meaning, what I guess I'm going with that is there's something that is a reality now that you find unacceptable and that you're working to change.
Yes. And I think living here in Guatemala, you see such a great injustice that so many people can't access healthcare. They don't have enough food just because of where they were born, just because of the color of their skin, the language they speak, that they are indigenous. Here in Guatemala, often that means you're the lowest in society. And people don't have control over where they're born or who they are. Yet here in Guatemala, unfortunately, there's structural racism. There's all of these issues that really keep people down, and they can't access, good healthcare, proper education, food. And so we're working really hard to change that and fill the gaps in care and provide people, the food that they need, the access to the healthcare education, and the empowerment to make choices over their own bodies. And it's not something that changes overnight. It is something that takes a lifetime to work on. And we're extremely proud of what we've done in the last 15 years. And we feel like we're at the point now to really leverage our last learnings over the last 15 years and really be able to scale and work with other nonprofits in order to make even a bigger impact across Guatemala.
And if you were to go back in time, and I know you've been active with the Maya Health Alliance now for 15 years, you guys founded it 15 years ago. But if you were to go back in time, that wasn't so long ago. But if you were to go back in time and think, this was maybe the moment that impacted me and pushed me to do this. Do you recall a moment like that?
Yes, I really do. It was something that when I was living in a rural community, I was living there for a year. I had a Fulbright scholarship and I was doing research, and I befriended a man who was a leader in the community, and he was an indigenous man, and he spoke three, indigenous languages, and he was really viewed as a leader in his community when he fell ill. And at this point, this was before Maya Health had started, and I was still learning a lot about the healthcare system in Guatemala. And long story short, after being turned away from clinics, after his family not really understanding what he had, when they really found the real answer, it was by far too late. And he had stage 4 cancer, and he had a major tumor in his liver, and there was not much that could be done. And so I joined his family through this process and definitely towards the end of life. And I really saw this situation as it was absolutely not necessary. He didn't have to suffer as he did. His family didn't have to feel so lost and invest money in different ways, in medications, in pathways that weren't going to work because physicians didn't give them the right answers. They really were lost in the system. It's very hard to navigate. They didn't always speak the right language or have the right color skin to really get through the right doors. And when he passed away, Don Andres, for me, that was a real spark that things can be better. We can do better. And I felt it sort of a calling, like, I have to be part of this. I have to make things better.
Ann Kraemer is our guest today here on The Edge of Adventure, Executive Director and co-founder at Maya Health Alliance, Wuqu'Kawoq, in other words. And she's joining us today from Antigua, Guatemala. Look them up online, mayahealth.org, mayahealth.org. There you'll find them also across social media. Look them up on Facebook for sure, and get to know them and show your support. What would be, of course, I think it almost always goes without saying that NGOs, nonprofits, these types of organizations, funding and gifts and those sorts of things always help to help the organization to reach more people and change more lives. I'm assuming that's the case for you guys as well.
Definitely.
Other than financial donations, which is a huge way someone can help, and I always encourage people, hey, if you connect with this particular group and this work in a very special way, be obedient to that and get involved and help them out. Right now, with the world being what it is, are there any other ways that people can be of encouragement?
Yes, I think that getting the word out and really understanding the situation is really important. I think getting the word out about the work that we're doing is really vital, but also understanding the situation for many people in Central America, in Guatemala, Honduras, El Salvador, as they're crossing the border. And no, people shouldn't be crossing the border illegally. It's a really major problem, and they're facing many problems in the United States. And I think it's really important that we understand why. Why are people leaving? And how can we as a population, as society, work at root causes? We can't just fix things overnight, but there are many root causes here in Guatemala that we have to address, such as climate change and hunger and discrimination and racism and lack of access to resources, clean water. And those are the things we have to work on. And we really have to think, together about how we can do that. And that takes everybody. Because this is a global issue.
And I'm going to ask you a question, and if you don't like the question, I'll edit it out.
Okay.
What causes racism?
I think racism is caused by fear and unknowing. I think oftentimes we might grow up in a place where everything is safe and the same, and people are from our same type of life and background and skin color and language. And we may not have the privilege or honor in meeting people who speak different languages or look different than us. And so I often think there's a lot of fear, and people don't know that maybe they look different than us, or they speak a different language, or they come from a different country, but who they are at their heart, their soul, about, that they want family and food and happiness. All of us want that. But I think oftentimes there's a lot of fear about the other, about that person over there. And I think, unfortunately, that's where a lot of racism and discrimination comes from.
And then to cure it, or to take that fear and to overcome it, which would be another way of saying that if a person does have that fear and maybe exhibiting a racism, to get past that, what's the key?
That's difficult. I think it's going to take a lot of us working together. I think it takes, a commitment from all sides to kind of walk a day or so in someone else's shoes, and to really understand what it's like, and to really understand that most all of us in the world want the same things, a house, food, happiness, safety. But that oftentimes what I see, even here in Guatemala, in communities, there can be discrimination within small communities. And oftentimes that's because the resource pie, if you will, is quite small. And I think globally, we think about that a lot. Like, well, I need the resources for me. I need to make sure I have enough for my family. And I agree, we do need to make sure we have enough for our families. But when can we say, how can we share? Or when is enough? And when can we, make sure that that pie is being shared better across countries, across communities. And I think a fear that we don't have enough is truly a major issue. And overcoming racism and discrimination is going to take many steps, but we can do it. We can do it together. It's going to take open conversation. It's going to take a lot of vulnerability. But I think it's really necessary in order to overcome a lot of the issues that we're facing in the world today.
And what would be your hope for the next few months? All of us, of course, we've come out of this very difficult time. We're still in a very difficult time worldwide. We all know that, and it's tough. It has been tough. It still is tough. But as you look ahead at the next 6 months to a year, what's your hope, or some of your goals for Maya Health Alliance?
So I think over the next 6 months for us is really providing that support to communities, continuing our healthcare, continuing to work closely with the Ministry of Health during this difficult time, because oftentimes the Ministry of Health has to close down some of their services. And so we're filling those gaps by providing, women's health and more nutrition services, because the Ministry of Health is so focused on the COVID-19 pandemic. We're also looking forward to, when can we rebuild post COVID-19? And so we're talking a lot about that. What does that mean? We've already kind of had new ideas about our team being able to do more hybrid work, even though, a lot of our team has to be in the field every day. How can we provide, different ideas for our staff to have a better balance for work schedule? And a lot of our patients have adapted to telemedicine. They're more open to it now. Cell phone signal and things like that don't always allow us to do 100% telemedicine here. But, it's really interesting to see all the possibilities that have come out of COVID-19. And we really look forward to focusing on what we're calling our Institute for Health, Leadership, and Equity. And that's something we really would like to focus on over the next 6 months and into the next year.
This is The Edge of Adventure, and my guest today has been Ann Kraemer, Executive Director at Maya Health Alliance, Wuqu'Kawoq. And Ann, I'm going to ask you the final question of today's episode, all right?
Yeah.
What about all this brings you joy?
I think I find joy heavily in my team, and really seeing the changes individually in different nurses and doctors and staff members, and seeing them grow. Oftentimes we'll have a nurse who comes in and she's very quiet in the first 6 months, and she doesn't want to share. because she's very used to kind of how things are here in Guatemala. And then over time, maybe in a year, seeing her voice her opinion to the PhDs, the MDs, the folks at the table and say, no, that's not right. This is what we're going to do. This is how, it needs to be done in the communities where I'm working. And seeing her leadership grow and change. And over time, she could become a manager of a program. For me, really seeing that change in our team is so phenomenal. Of course, the other piece that brings me joy are our patients and seeing the great health outcomes. We deal with cervical cancer, we deal with other types of cancer, and being able to see families, be together because we're able to provide services, chemotherapies, treatments for patients that can overcome cancer when financially there was no way they could have, had cancer therapy. And for me, there's joy in every day in the work that we're doing, whether it's with children or adults. It's hard. There are days that are really difficult, but I think overall, it's the little things, working with my team and seeing these, patient outcomes.
This has been The Edge of Adventure. Today, we've spoken with Ann Kraemer, joining us from Antigua, Guatemala, and the Maya Health Alliance. Look them up online at mayahealth.org. That's mayahealth.org. You'll find out more information, get to know them, come alongside them, support them, and encourage them. Thank you so much, Ann, for your time today, and thank you for what you do. It's clear that you're playing a very important role in the lives of these communities, and that's an inspiration.
Thank you so much for having me. Thank you.
And thank you all for joining us for another edition of the Edge of Adventure podcast. We'll see you again next time.